There are a lot of advantages to using the Da Vinci surgical system. Patients used to come in and they would be in the hospital at least 2 or 3 days with a lot of extra pain, large incisions, lots of drains. And now with the Da Vinci surgical system, it's much different. The patient comes in, they get their surgery, and they go home the next day. I mean, what's better than that?
One thing that I didn't realize when I first started doing this was whether or not pain was going to become an issue. As I started seeing patients post-operatively, patients had less pain.
These are life-changing procedures that we do over here, and I'm hoping that with the robotic procedures that we are doing and we will continue doing, we're going to make their life even better.
To do surgery the right way and to be able to perform any of the high-level index cases, I mean, to me, that's impressive for any patient.
Well, we started robotic surgery here back in 2010. The idea was introduced to me by administration. They needed a bedside assistant to get trained to assist with the robotic procedures. I underwent extensive training, both in Florida and in New Jersey. And I've, to date, probably done a couple of 100 robots here at Peconic Bay Medical Center.
And I think you get the advantage of having well-trained people in a community setting using state-of-the-art equipment.
The benefit to the Da Vinci approach is the 3D imagery. The visualization is better, and having such a powerful camera enables you to get closer to the tissues, at least theoretically. I mean, certainly when you're open, you've got to stay a foot or two away from the operative field. Laparoscopically, you're a little closer with a camera, but you're limited by awkward instruments and 2D imagery. But then when you move forward into Da Vinci, into the three-dimensional spectrum, you have everything you're missing. You have a much closer view, you have a three-dimensional structure, you have wristed instruments, and so it really takes it to the next level, and again, improving patient outcomes all the way.
Doing the surgery with his hands, the robot is just replicating what the doctor's doing. It's a better procedure because we can be much more precise, and the patient gets a better outcome because of it.
But I also think the most important thing that the Da Vinci offers us is it gives us a tool to do our cases to the best quality.
Yeah, you can liken it to the old saying, if the only tool that you have is a hammer, everything starts to look like a nail. If the only way that you know how to manage a patient is through open surgery, you only think about open surgery. The Da Vinci is an additional tool.
The Da Vinci is really an extension of laparoscopy, so if you're comfortable doing laparoscopic surgery, it's a fairly smooth transition.
The dedication to providing the community with the highest level of care, to me, that's what it's all about.